Types of diseases. You must have heard the names of various diseases like diabetes, common cold, asthma, Down syndrome, heart disease, etc. Reasons and symptoms of all these diseases are different. To bring coordination in scientific study of diseases, diseases are classified as follows, and let's observe in this concept map. Acute and chronic diseases. The manifestations of disease will be different depending on a number of factors. One of the most obvious factors that determine how we perceive the disease is its duration. Some diseases last for only very short periods of time, and these are called acute diseases. We all know from experience that the common cold lasts only a few days. Other ailments can last for a long time, even as much as a lifetime, and are called chronic diseases. An example is the infection causing elephantiasis, which is very common in some parts of India. Chronic diseases and poor health. The acute and chronic diseases have different effects on our health. Any disease that causes poor functioning of some parts of the body will affect our general health as well. This is because all functions of the body are necessary for general health. But an acute disease which is over very soon will not have time to cause a major effects on general health, while a chronic disease will do so. As an example, think about cough and cold, which all of us have from time to time. Most of us get better and become well within a week or so. And there are no bad effects on our health. We do not lose weight. We do not become short of breath. We do not feel tired all the time because of a few days of cough and cold. But if we get infected with a chronic disease, such as tuberculosis of lungs, then being ill over the years does make us lose weight and feel tired all the time. we may not go to school for a few days if we have an acute disease. But a chronic disease will make it difficult for us to follow what is being taught in school and reduce our ability to learn. In other words, we are likely to have prolonged general poor health if we have a chronic disease. Chronic diseases, therefore, have very drastic long-term effects on people's health as compared to acute diseases. Causes of diseases. What causes disease? When we think about causes of diseases, we must remember that there are many levels of such causes. Let us look at an example. If there is a baby suffering from loose motions, we can say that the cause of the loose motions is an infection with a virus. So, the immediate cause of the disease is a virus. But the next question is, where did the virus come from? Suppose we find that the virus came through unclean drinking water. But many babies must have had this unclean drinking water. So, why is it that one baby developed loose motions when the other babies did not? One reason might be that this baby is not healthy. As a result, it might be more likely to have disease when exposed to risk, whereas healthier babies would not. Why is the baby not healthy? Perhaps because it is not well nourished and does not get enough food. So, lack of good nourishment becomes a second level cause of the disease the baby is suffering from. Further, why is the baby not well nourished? Perhaps because it is from a household which is poor. It is also possible that the baby has some genetic difference that makes it more likely to suffer from loose motions when exposed to such virus. Without the virus, the genetic difference or the poor nourishment alone would not lead to loose motions. But they do become contributory causes of the disease. Why was there no clean drinking water for the baby? Perhaps because the public services are poor where the baby's family lives. So, poverty or lack of public services become third level causes of the baby's disease. It will now be obvious that all diseases will have immediate causes and contributory causes. Also, most diseases will have many causes rather than one single cause. How do the individual and environmental cleanliness contribute for disease causing factors? Can you think yourself? The personal hygiene, public health and community health factors should be kept in mind when we think about causes of diseases.